So good afternoon and welcome to West Park Foundation's annual town hall, where we thank our supporters for helping UHN's West Park Healthcare Center achieve its mission to get your life back. I'm Doug Earle, and I'm the CEO of West Park Foundation. Thank you for joining us on what promises to be an informative and hopefully stimulating town hall discussion. I'm grateful to our doctors, Dhillon, Goldstein, and Depradine for their participation and insights that they're going to share with us today. I would also like to welcome Janet Newton, our VP Clinical from University Health Network, and Janet Griffin, the chair of our West Park Foundation Board, who will be speaking shortly. And to welcome to all of our West Park patients who are watching on the integrated bedside terminals in their rooms, and to those members of the community who are watching on YouTube. We really appreciate you joining us as we stream live today's event. We have many people to thank today, but in particular, there are two groups that I wish to mention right now. First, I'd like to ask our volunteer members of the Foundation Board to stand and be recognized. So please, even our new members, come on. So thank you for joining us. We do have a board meeting and an annual meeting later today, but it is providing your time, talent, and treasure in the oversight of West Park Foundation is very much appreciated. We appreciate your service. And secondly, I'd like to thank all of our donors who supported and continue to support West Park's campus development and the opening of our new hospital building that we're in today. It was an amazing day when I volunteered along with countless colleagues to move in 250 patients on April 14, 2024. It's hard to believe that it's been over a year. Just unbelievable. Our discussion today will focus on how our hospital building is enabling West Park to increase access to our very much in demand programs and to be innovative in how we deliver them, and to open new programs to better meet the needs of our patients, including complex healthcare needs of an aging population. Today, people over 65 represent 17% of Ontario's population, but they also represent 58% of hospital stays. In fact, in the next 10 years, just the number of people over 75 will double. So the changing demographic is the greatest healthcare challenge of our time. And with the remarkable new facility that we have here and the world-class clinical and staff team, we're preparing to meet it. We are only in this building because of you, our donors, and we are grateful for your support. The generosity of our donors can be seen throughout the building in the many namespaces that recognize and celebrate their philanthropy and over 700 pieces of art that they donated as a part of our art strategy. We are in one now. The Weisham Auditorium is named by a former Foundation board member, David Weisham, and his wife, Lori, and his sister, Susan. David came to West Park to recover from an illness, and with the help of our team, was able to get his life back. He knows firsthand the wonderful care our skilled physicians, nurses, and therapists provided to him and to many others, and wanted to make sure that our redevelopment was successful and help many people access our world-class care. Like David, many of our donors were once patients. Tim Casson is another. He was a Mississauga firefighter who in 2014, while fighting a fire, was caught in an explosion and a collapse of a building on top of him. It almost costed him his life. After more than a month in acute care, he came to West Park to finish his recovery journey. With our help and his very much own determination and hard work, Tim was able to return home to the family he loves and to a job that inspires him. Each year, Tim and his firefighting colleagues participate in our Tournament of Stars fundraising event. Together, they are grateful for the care Tim received and want to make sure that others can access that same level of care here at West Park. Our donors make a difference in the lives of our patients. And like David and Tim, on their behalf, I say thank you. We have more to do to complete our campus transformation. We are currently, if you look to the west, we are under construction still. We're creating our unique outdoor spaces that will help support our patients on their recovery journey. As well, we are renovating our legacy building, which will add an additional 188 beds to the health system when it is completed in 2026. Look for news from us over the coming months for this important completion of our campus transformation. Our new hospital building, however, was not only a transformational event last year. We joined the University Health Network family of hospitals, an integration that is enhancing our research program and bringing many benefits and improved access for our patients. So I'd now like to call on Jan Newton, UHN's VP Clinical, to say a few words on behalf of UHN. Janet?
So thank you, Doug. So many great stories, so much great impact that our donors have on our patients, and it's really lovely to see so many of you, both donors and patients, here today. So I'm really happy to be here. I'm Jan Newton. I'm one of the clinical VPs, as Doug said. Very happy to be here on behalf of our President and CEO, Dr. Kevin Smith, as well as our UHN senior leadership team. And we really do want to share our thanks with all of you for your support of our West Park patients and for, as I've said, for being here today. So it's been a year, and it's gone so quickly. And we moved over, as Doug said, 250 patients. I'm very happy to report that as of this morning, we had 303 patients under this roof, and that's out of an absolute maximum of 306 beds. So we are full, we are busy, we are taking folks with all kinds of challenges. We are bringing them here to really help them get their lives back. So it's been a busy year, and I do also want to thank the clinical teams as well as the operations teams who really have made the building come alive. So when I joined West Park, I knew about it, obviously. I knew the strength of its programs. I knew it was a fabulous place. It has a really innovative approach to delivery, and it provides outstanding care for its patients. But this new building is enabling us to make advances in all of these areas, and the integration with UHN has also been really impactful for both parties, for West Park as well as for UHN. So by leveraging the strengths of all of our organisations, we really are creating exciting patient care initiatives as well as these research and educational opportunities. So we're going to hear more about the care that we deliver from our medical colleagues in a moment. So there has been a ton of change at West Park over the past year. And again, I want to thank everybody who comes to work every day for rolling with that, because there's been a lot for them to embrace and to learn. But what hasn't changed is the commitment and the spirit of this building, and the commitment to the patients, and the skill and dedication of our patient care teams. So whenever I do talk to West Park patients, and I just had the absolute joy of joining an ex-patient, a patient who's graduated, in with us today, but I do hear genuine appreciation for the care that they receive, and it is really important to us that our team put our patients' needs first. That's our UHN mantra, is the needs of our patients come first. But I hear that loud and clear from patients when I stop and chat with them. And then finally, obviously, our donors, you are so important to us. There is so much work that happens every single day in the building that we couldn't do without you. Our base funding dollars simply don't cover many aspects of care, education, and research. And so we do rely on donor dollars to make us excel in areas that we would otherwise struggle with. But at the end of the day, it's here to better support our patients and to better support the care that they need, but really for our patients, they're the ones who are doing the hard work. So I want to thank you all for your commitment. It comes in many shapes and forms. I want to thank you all for your commitments to West Park and to truly helping us give our patients their lives back. So thank you, and thank you, Doug.
So it's been tremendous being a part of Canada's #1 hospital, and according to Newsweek, the third best hospital in the world. #1 publicly funded hospital in the world is UHN. So it's very much great that West Park could be the 5th hospital in that family. So thank you, Janet. And now I'd like to invite our foundation chair, Janet Griffin, to bring greetings on behalf of the board.
It looks so great from up here. It's so nice to have a full room. Thank you for being here. And thank you, Doug, for that introduction. I am just thrilled to be here today. It's always fun when we have our town hall. It's always a great educational experience, and it also brings home the importance of what we do with our patients each and every day. I'm delighted to be here to thank you, our donors, on behalf of the West Park Foundation Board of Directors for your very generous support of our hospital and the patients that we serve. As Doug mentioned, 2024 was a momentous year. Our new hospital opened and we joined UHN, which Jan referred to, but it was also our 120th year. And so this hospital has had a long and quite wonderful history here in Toronto, 120 years of helping people recover and get their lives back. You may or may not know that we started as a tuberculosis hospital, the result of a very, very generous legacy gift. In 1904, Sir William Gage was very concerned about the scourge of tuberculosis in the downtown core of Toronto, and he purchased the Buttonwood Farm, on which we sit right now, along the Humber River, so that he could create a restful and healthy place for people to recover from that disease. As the city grew and surrounded us, West Park expanded its expertise in respiratory medicine to become a national leader in rehabilitation and complex continuing care that we are today. Our facilities have certainly changed over the years. The state-of-the-art building we're sitting in right this minute is a far cry from the old TTC streetcars that we used to house our patients in. But what hasn't changed is the generosity of our donors. And thousands of gifts came together to become the cornerstone of this new hospital building. Every single gift made a difference to bring us to this point today. Please accept, on behalf of the board, our deepest thanks for being part of our generous community and for your commitment to West Park, and to our patients as they work to get back home to the lives that they love. Thanks for being here today.
So thank you, Janet. And now I'd like to welcome to stage our medical leadership that is joining us. So Dr. Dhillon, please, our medical lead at West Park, Dr. Goldstein, head of respiratory medicine, and Dr. Depradine, physician lead for geriatric medicine here at West Park.
So I have the privilege of talking to a number of people who call and say they want to make a gift to West Park to say thank you for the care that they've received by you and your staff. And they tell me now that we have this new building, that our facilities match the excellence and expertise of our staff, when they experience as a patient or their loved one was here at West Park. So recognizing that donors played a significant role in the creation of our new building through their philanthropy, how is the new building helping your progress? Dr. Jamal?
I'll just begin by also just thanking the generosity of our donors as well as our board members. It is really appreciated, and it does make a huge difference in terms of the quality care that we're able to provide our patients. In terms of this building and the infrastructure that we have, I think I'm going to go out on a limb and say that we probably have the best rehabilitation space in the country right now. And I think that space allows us to really be innovative and start thinking about different ways to help patients and their families and really help that transition as they transition home or their next place of care where they receive their care. Obviously, the new building has helped our recruitment strategy. I believe approximately 500 new healthcare workers have joined our team in the last year and a half, 2 years. The other thing I would probably add is, we have some unique facilities within the new hospital, and such as the new custom-made prosthetics and orthotics department, which is developed and designed with input from our prosthetists as well as our orthotists. So really custom designed for their needs, rather than having a standard space and needing our healthcare team to adapt to that space.
Dr. Deputy?
Thank you. So for the geriatric medicine group, this transition to the new facility has been extremely impactful in regards to our mission to deliver the right care in the right place at the right time, and really to embolden and empower our patients to be active and independent in their homes and in their communities. And some very specific examples of that are with our geriatric medicine clinic, where we work as a team, and many of the members of the team are here today, this afternoon as well. We have been able to now access 16 assessment rooms as opposed to the old facility where we had about 6. And with that, in the last year, we were able to see over 500 patients in the clinic. The target that's set by the Regional Geriatric Program of Toronto was 300, so we were able to see nearly double our target because of the additional space that we had and because of the fantastic work of our team. With the new hospital, we were also able to launch our Geriatric Day Hospital, which is a program that offers anywhere from 6 to 8 weeks of multidisciplinary support, occupational therapy, physiotherapy, nursing, potentially access to our social worker, and this is the only geriatric day hospital west of Bathurst in Toronto, and it's really evolving into a regional hub for Northwest Toronto. And that's only because we are here and because of the generosity and the support of our donors, of the foundation, of the University Health Network. The inpatient programs are growing as well. They've been here for 3 years, and with the geriatric rehab service, we've had year-over-year growth in terms of our admissions. The last year, we're seeing a lot of very complex patients, but we are helping to transition them back to their communities, back into their homes, and really fulfilling the wishes that many of our patients have in terms of remaining independent and active for as long as possible with the support of our team. And then finally, the spaces allowed us to really expand our academic and educational engagements. We have a lot more space now for teaching, a lot more space for bringing in students, both in terms of experiential learning, but also in terms of didactics. We've had now built a relationship with McMaster University over the last year, bringing in physician assistants, undergraduate medical students, from the University of Toronto, residents as well, and we're looking to continue to expand, bring in students and learners and with our research endeavors. So the facility has been truly impactful, but also the people have helped us to get to this point. The people who are here today, the foundation, our fantastic team, so just very grateful for the opportunity to be here and for the people and the facility.
Dr. Goldstein.
Is there more for me to say? I mean, I want to echo my colleagues. I think it's easy to underestimate the value to your health of working in an environment where there is light and space. And I think not just the health of the patients, but the health of the staff. And we have challenges not only to care for our patients, but to attract and retain good quality staff. And there's no question walking down a new, bright light corridor is a pleasure. For our particular department, one time designed to be a flagship, but we were in the basement in the old building, so functioning as a submarine more than the flagship, but it's made a big difference. We have both clinical programs in rehabilitation, we have inpatient, outpatient, maintenance, virtual programs. They all require space, and the gymnasium requires space. We have programs in teaching, and the people who come here to learn and work with us, we require rooms to teach, and in clinical research, both to see patients, to write protocols, and to think. Actually need space to think that isn't cluttered. So all the dimensions of our program benefit from the space. We benefit as staff, and I really believe our patients benefit as well.
Thank you. So, as we mentioned, it was a very tremendous year for West Park, 120 years that we've been operating on this site, helping people get their lives back. So how has West Park's integration with the University Health Network improved our mission?
I would say there's been a number of things where we've really started to expand our clinical footprint as a whole. I think we're able to start looking at the art of the possible, really dreaming much bigger than we were as a smaller community rehabilitation hospital. And integrating with an acute care partner will help us continue to leverage the strengths and patient integration pathways to develop something that's quite larger and really integrated. And obviously UHN being one of the largest, if not the largest, tertiary site, quaternary site in the country, leveraging those strengths and uniqueness of certain programs will really develop a unique footprint in both that will have a significant academic and research profile overall and an impact for our patients.
From my perspective, the integration with UHN has been really impactful in respect to the access to collaborative expertise and collaborative leadership. One of the examples of this is with UHN over the last 9 months or so, we had identified a gap in geriatric medicine, and that's specifically with geriatric psychiatry and access to geriatric psychiatry resource in the ambulatory or the clinic setting. We were able to work with the Center for Mental Health at UHN. There was a psychiatrist who was interested in joining West Park, and we were able to develop a geriatric psychiatry clinic, implement the protocol, again, working with the team, finding appropriate patients, and with the collaborative expertise and leadership, we were able to implement this, and it's been very impactful in the sense that previously we would have to refer out somewhere else, whether it's Humber or elsewhere, and patients may be waiting months to see a psychiatrist for depression, anxiety, behaviors, and dementia, and now we're able to house that expertise here at West Park, but also leverage UHN as well if there are other issues, whether it's with mobility, et cetera. And one of the other aspects is with education and teaching. Our relationship with McMaster that we've developed has been through the University Health Network. We've met with the Institute for Education Research, looking at really encapsulating our approach to teaching, which is very experiential and reflective, disseminating the knowledge. We've been producing quite a bit, with our team. So there's so much, and I completely agree with Dr. Dhillon. Really, the ethos is why can't we? Why can't we grow? Why can't we be the most excellent? Why can't we, as a group and as a team and as people, really be the premier geriatric medicine program in the country? And I think that that is very realistic and very feasible, again, with the support and with the collaborative work.
Am I last for every question here? Is that
You can keep the mic. You can keep the mic to start the next round.
You can't be everything to everyone, and being associated with a first-class organization is a huge advantage to us. Again, in all three dimensions, in clinical care, in teaching, and research. In clinical care, I can pick up the phone and speak to colleagues who are very, very accomplished. And that is a huge advantage. In our teaching, UHN brings wonderful resources to the table, great experience, and diverse individuals who we can get a part of if we need and when we need. And clinical research, very much the same thing. In fact, we have the development of a Center of Excellence, a lung institute between West Park and UHN. There'll almost certainly be other partners that will allow us to play our role, particularly in rehabilitation, in ventilation, and in tuberculosis. So, for instance, we have a joint chair coming in July. Dimitri's being appointed in July, in respiratory rehabilitation research. And we have other proposals cooking to develop more expertise in tuberculosis. So UHN expands and extends our reach, and that's hugely important to our patients and our science.
So you keep the mic, because the next question is, given our new building, have we been able to launch new programs and in order to fill the gap in the health system in the last year?
I can only speak for respiratory, so my colleagues will speak. We've launched some really great stuff, actually. We created a national portal of rehabilitation programs. So any Canadian in the country, based on the postal code, can find out where the nearest program is, can download the referral information, can learn about what happens in the program. That's a real plus. I mean, initially we started looking for our area, then for Ontario, and then we decided to make it national. That's launched. That's a new project in the last year.
And that was driven by research.
That was driven by research because during COVID, the rehabilitation programs pivoted to being virtual. Patients were rehabilitated at home. We wanted to know across the country how that was changing. So we found ourselves accumulating addresses of programs, and we figured maybe we could do something a little more with that. So yeah, that came from research. There's a community up the street, Black Creek, at Jane and Finch. It's a somewhat disadvantaged population. We've launched a program together with them to try and improve population health for their catchment area. That's been very well funded, thanks to Doug's contacts at the financial institutions. But that's an example of where we've been able to reach out to our surrounding community as a result of the expansion and create a program to improve population health. So that's just a couple of them.
Dr. Depradine?
So from the geriatric medicine perspective, one of our main objectives is identifying gaps and identifying challenges, as Doug mentioned, and developing creative and innovative solutions to fill those gaps. And we've been, from my perspective, doing that well over the last 1 to 2 years. One of the things that we had identified with some of our regional partners is older adults who are in emergency departments, presenting for whatever reason, whether it's falls or pneumonias, and being in a space where they may be sent home and they end up coming back to the emerge, or they're in the emerge for 1 or 2 days and they end up with a delirium or with a fall, et cetera. So we started with St. Joseph's Health Center and identifying older adults in the emergency department who would benefit from a expedited transfer to a dedicated geriatric unit for geriatric rehab. There are many hospitals that actually don't have dedicated geriatric units, whether they're rehab or general medical units. We branded the ED Rapid Rehab. So identifying with the geriatric emergency medicine nurses at St. Joe's, they would connect with us. We developed a pathway, spent actually several weeks doing this collaboratively with St. Joe's. And then the patients within 24 hours being transferred to our facility to spend time with our team, physiotherapists, occupational therapists. I see all the patients who are here, all the inpatients. And then facilitating more successful transfers home, but also mitigating potentially avoidable admissions to busy acute care centers, so helping them on their end. And it's been successful over the last 2 years. We've been able to expand from St. Joe's now to Humber, to Cordalucci, to William Osler, UHN as well. And we're now in the process of publishing a paper on the process to develop this innovative approach, our experience, and how this can then be translatable. The Toronto Western Hospital is in the process of opening a seniors emergency department, so we have now some of our experience in terms of where do the patients go after they enter Toronto Western, because the seniors emerge is a space, but where do they go, what is the connection, and that's an important aspect in terms of thinking. And St. Joseph's Hospital as well is now developing their seniors emerge, recently put that in place. So we were, I would say, in some ways ahead of the curve. We saw an issue and we anticipated it, and I think that that has been, one of the aspects of our group, finding, these. The other, in terms of new things, very quickly, is our geriatric day hospital, with Kimberly Day and the team here. That's been in place since August with the new facility. We launched our geriatric psychiatry clinic, again, identifying a need and putting it in place. And we have also started new relationships in terms of teaching and education. So there's a lot of growth and a lot that's going on in terms of expansion with geriatric medicine here at West Park. And the foundation is, again, with an aging population, and knowing that the way that we treat and the way that we help to support our older adults is really reflective of our values as a society and our success in healthcare. Success in healthcare and good healthcare is good care for older adults. We are here to be innovative, to be creative, but also to be collaborative and to share. And we're looking forward to continuing to share in terms of collaborative program development with UHN and with our donors, our foundation, and our fantastic team.
Thanks, Jamal. I think I'll speak about from a neurological rehabilitation perspective. I think with the amalgamation with UHN, we likely have one of the largest neurorehabilitation programs in the world. As a result, we are able to start to realign and sort of figure out how to programmatically what's the best way to provide neurological rehabilitation to patients across the city. Along with that, we've launched an early supported stroke discharge program where we provide outpatient-based stroke rehab for patients 5 days a week, 4 to 5 days a week, where instead of being an inpatient, they would come in from home for 1 to 2 hours a day and get that therapy on an outpatient basis. In the coming months, in September, we will also have the neurorehabilitation program from the Rumsey Center being transitioned over as well, further expanding our neurological rehabilitation footprint as a whole to the site. And I'll just add that overall, from an outpatient perspective, over the past year, we've increased our patient volumes by approximately 46% since we've moved into the new outpatient clinic space. And that's just in year one.
So I have a final question before we turn it. Why don't Dr. Depradine, why don't you start this time? Because just to be fair.
About time.
Yeah. I have one final question before we turn the tables and go to the floor for any questions. So the final question is, what are you working towards in the year ahead that would be exciting to our donors and supporters?
So what we're working ahead and looking ahead to in geriatric medicine is being a paragon and a leader for getting geriatric medicine out into the community. We have a lot of great medicines being delivered at the primary care level, at the community level, and ultimately for our system, the way we envision things is that keeping people well, mobile, and healthy in their communities and in that space is really the most impactful thing for the system in terms of reducing people getting to emergency departments or needing to be admitted to hospital. And that is collaboration in terms of multidisciplinary education. So nurses, social workers, occupational therapists, working with our family health team. I've spoken with the Toronto Western Family Health team that's very eager to work more closely with us. Crosstown Family Health, which is our group that we work quite closely with. So what we are looking forward to in terms of our relationships, in terms of our expertise, is to continue with program development, continue with our increase in clinical volumes, which we've seen, recruiting more geriatricians here to West Park. We have one so far, and we are very optimistic that we'll have at least another within the next year, and then really continuing to develop this model of multiple specialties really learning and truly working together and getting out there and seeing people where they are and helping them to remain as successful as they can where they are, which I think is a goal shared by our team collectively, the respiratory team, the neuro team, West Park, and facilitating successful transitions back home. But I think we can, and my ethos is why can't we? And I think that there's no reason that we cannot.
Lofty goals.
We can only be the best in the world.
Yes.
And that's where the buck stops, out there somewhere. We think we're close to the best in the country in terms of pulmonary rehabilitation and long-term ventilation. Our partnership, for example, with UHN, they're probably the best transplant program in the country. It's a partnership made in heaven. It's a natural fit. So we will always push to do more and do it better. So a specific example, you asked me to try and give you an example. Some of the research we're doing, we figure patients who exercise with 2 legs get very short of breath, so we've hit on the idea of doing one-legged exercise. Sounds ridiculous. Turns out with one-legged exercise, you can go further, longer. So we train one leg, then we train the other leg. So we have now about 5 papers published on this. Our goal is to integrate it into the standard of care nationally and globally. That's an example when I say we can only be the best. We want to move innovations forward. We want to broaden the uptake. In ventilation, we're planning to have a national conference in 2026. Jan, I forgot to mention it to you. We're looking at, there's a space. There hasn't been much at a national level in this area. We're the right place, we're the right address. That sort of thing. In respiratory, there is a huge burden of mental health that's underappreciated. So in the next year or two, we plan to try and make this a focus. There isn't one center in Canada that focuses on mental health in the respiratory population. So that's what we're looking to do, big stuff. And it's great.
Well, the mic's being passed back. In fact, at UHN, 203 lung transplants were done last year. Over the first 1,000 lung transplants, the threshold had been met. And because of UHN innovation with the ex vivo provision, half of those lungs were able to be transplanted. We would have lost half of them. So tying West Park's rehab, respiratory rehab, with lung transplant, with the lung cancer program at Princess Margaret's, there's no stage like it in the world. And I look forward to the work of your team, Dr. Goldstein, in helping people breathe better.
From my end, there's 2 projects that I'll be working on. The first being the lower limb preservation strategy and reimagining an existing limb preservation strategy within UHN. And really leveraging some of the assets that we have here at the West Park site, particularly our amputee and prosthetics and orthotics departments. We really are aiming to do 2 things. One is to really make a dent in our horrendous levels of limb loss in our preventable vascular issues with patients. So reduce the risk, really have an impact on patients across the province and reduce the risk of limb loss. The second is really become the site, the place for research and education in terms of amputee and prosthetics care for the country in the next couple of years, and really becoming subsequently a global player in amputee and prosthetics research. The second project I'll be working on is a bit of a pet project for me. It's really building a larger educational portfolio here at the site, centered on a new relationship between UHN and the Toronto Metropolitan University, TMU. TMU will be taking on their first medical cohort July 1st, so just in 3 weeks. They'll be opening their doors for a new set of residents, and subsequently, a couple months down the road, a new class of medical students. There's some shared values there between TMU and their new vision, one of which is really being community-centric. West Park has a long-standing history of a strong relationship with its community. And from post-acute care perspective, that relationship is really important. So looking at that relationship and building on those relationships with the community, I think Jamal had just mentioned from a geriatric perspective how important the portfolio we see as geriatrics grows, the impact we want to have on our community. We want to have that impact on our community across the board in all our programs. And that really entails involving education and collaborations with universities. Both the University of Toronto, which is pre-existing that relationship, but also add on a new relationship with Toronto Metropolitan University as they expand their interest in medical education and research.
So now we have some time to turn it over to the audience, and Martha has the mic if you want to put up your hand to ask our panel some questions. And Janet Griffin is never shy. That is so true.
I never miss an opportunity to ask a question. Dr. Depradine, thanks for your comments. I am curious, knowing what we know about the demographics in Canada and the number of 75 plus people doubling in a decade, other than cloning yourself, how do you see our capacity growing? How do you see our ability to meet that challenge?
That's a great question. It was actually something that we were discussing. I had met with my team shortly before this event. And one of the mechanisms, I think, to really meet the challenge, I'll give you two, is really disseminating geriatric knowledge beyond, let's say, the MD base. So here we're bringing physician assistants. You know, we had a group of occupational therapists who were with us for a month as well. We had a physiotherapist with us in clinic, and really learning about memory changes, learning about mobility, learning about how to communicate with an older adult who has social challenges or who is isolated. Identifying depression in an older adult is something that can be taught to many different people within the healthcare stream, social workers as well. And I think that that is really helpful in terms of identification, but also starting to implement interventions earlier upstream, which is really important. And that's where, again, working with family medicine, family health teams can be really critical because they are often the front line. The other aspect is really, again, program development and innovation. So what can we put in place to help to support older adults who are in their communities, whether that's social programs, communal dining, clinics in terms of legal aid, things of that nature. So working with the social justice system, working with government, et cetera. So it's really an effort that requires multiple players, not just within medicine itself, but within the allied health, the social services sector. And again, where we sit, West Park, within post-acute care, within rehab, we're really at that nexus because we are dealing both with our partners at Toronto Western, Toronto General, further upstream, we're dealing with our primary care partners, we're training people from Toronto Metropolitan, soon the University of Toronto, McMaster, et cetera. So we are really sitting at a very, very critical nexus, and that's why I believe that as an organization, we are likely going to be the type of organization to lead that change because of where we sit within the healthcare system, and I think that we're well positioned to do that.
Thank you. Can I ask a follow-up? Is it your belief that our government system will support all that growth, or is this somewhere where private funds can help you?
I think that private funds will be necessary. There's so much that the government and the public system can do, and there are certain priorities that they have as well. And I think that's going to be an effort collaboratively between private and public, and that's where the foundation, our donors, the impact has already been there. Again, if you look at our numbers over the last 2 or 3 years, the clinical volumes have been increasing, the program development has been there. You know, we're getting amazing feedback from our patients in terms of their impact on from our families as well. So it's not just, I would say one of the things just to summarize with our team is that I've been really proud of is that we have done it. We've gone out and we've put the wheels in motion. We're seeing the patients, we're doing the things that we're being called, and above, as I said, our target was 300 visits. We did, I think, 550. So it's going to be a combination, and we're hoping that we can continue to work really closely with our donors and with our community to be able to continue that upward trajectory and really just continue to be excellent.
And support your research so that we can help others have the West Park experience through knowledge translation of your papers and studies.
Most definitely.
That we're doing. Anyone else? Oh, someone in the back row there.
Thank you. As someone who lives in this neighborhood, it's very, how would you call it, cool to hear the people behind the community initiatives. So Mother's Day, I happened to be at Jane and Finch, and we did pop into that, I guess it's your Black Creek health clinic that you have upstairs, and they were doing certain health checks. So we take this for granted when you're in the community, but it's awesome to see the initiatives that you start here that reverberate further. So I'm out in this community a lot and all over Toronto. I meet a lot of young university people that are studying psychology and different things. And you said that you're looking to do community collaborative program initiatives. And it is a very challenging time for a lot of young people, a lot of disconnection since COVID, and some people aren't around their grandparents and stuff. With the studies you've done and maybe what's happening in your initiatives that you already started, is there any movements to involve youth in the different communities, projects, helping with the seniors? Yeah.
I'll take that one. We have a major initiative with the youth around the Black Creek program, with the Quash program. Through the Lung Health Foundation, they have apps both for smoking cessation, but more importantly, maybe in some ways, to reduce vaping. So we've connected with them and with the workers who go into the schools, and we're involving the youth in identifying these apps, taking these apps, and learning about how to discontinue vaping. That's entering a major stage now.
I believe we're still in the early stages of a lot of the community aspects. Particularly, I think we are very interested in supporting this community. This area is known as a primary care desert. The lack of access to medical care, high quality medical care, is lacking. One of the initiatives we will be looking at and are looking at currently is bringing in a larger footprint for primary care. A real integrated model, a unique model in terms of developing that's going to be closely related with some of the post-acute care, the rehabilitation assets that we have at this site, and helping to support the community as a whole. So, more to come on that. It will likely involve one of the university partners, probably TMU, as we develop that, but more to come.
And I would also add, in our water therapy pool, you can go to Toronto Recreation and sign up for, when we're not using it, for our rehab therapy. It's available to the community with the water aerobics program, which is keeping quite active, and we appreciate that community partnership opening up a service that didn't exist in the neighborhood. Oh, we have one more question, and then we'll wrap up.
I think this question is for Dr. Goldstein. It feels to me like I'm seeing much more news about COPD, and I'm wondering if cases of it are on the rise, and what's causing that, if that is the case. You talked a little bit about vaping. Can you give us an update on that?
Do you know, I think there is more in the news because I think there's an increased awareness. I don't think cases are on the rise because the biggest cause was smoking, and the percentage of adult Canadians smoking is coming down, and it's plateauing. But I think there's more awareness, there's earlier detection, and there's tools to manage. So there's not much point in publicizing something if you can do nothing about it. So I think what the media have picked up on is now that there are tools, both in terms of pharmacologic through medications and in terms of rehabilitation programs. So we now have a more optimistic view of this condition. So I think that's why you might be hearing more about it. And it's a good thing you do, because we calculate that about 50% of patients with COPD in Canada are undiagnosed.
So thank you. Do we have one more time for one more? Why not? Squeeze it in.
Sure. So limb loss primarily is driven by dysvascular disease, which approximately 85% of all amputees in this province lose their limb because of diabetes and smoking-related issues. So issues with blood supply. And these are preventable. So managing diabetes, providing education is paramount in terms of preventing limb loss. Partnerships and relationships are going to initially start with integration within the healthcare system and different partners. So having a relationship between different specialties, be it endocrinology, chiropody being quite an important aspect of limb preservation, where having appropriate nail care and foot care through a chiropodist is going to be critical. Making sure you have the expertise of a physiatrist or rehabilitation specialist that looks at offloading foots that are already at risk or have ulcers on them. And optimizing from a medical perspective, making sure that they're on the best medications to reduce their risk of the vascular disease progressing further are all going to be aspects of the limb preservation strategy as we develop it. As we start to solidify the organization within UHN, the subsequent step would be to reach out to the communities that are most in need. Those communities are the northern communities in the province, as well as Indigenous communities in the province. And creating strong relationships with those communities. We will be leveraging the strengths of social medicine. Typically, the individuals who lose their limbs are, from a social determinants of health perspective, the most vulnerable in our society. Precarious housing, unemployment, mental health are all major factors in the patients that we see and treat. So all those need to be addressed as we continue to develop and formulate the best limb preservation strategy that's tailor-made for the province of Ontario.
Great. So thank you, Drs. Dhillon, Depradine, and Goldstein for joining us today and sharing how our new building is transforming care and addressing the aging population. And I'd like to thank all of you for attending, whether you're on YouTube or one of our integrated patient terminals, bedside terminals here in the hospital, and for all of you for coming in person to share how your support is making an impact in the lives of our patients. We just couldn't do it without you. I hope that I'll see you at a couple of our upcoming events, our golf tournament on August 11th at Lambton, and our culinary showdown November 1st on the CNE grounds. You can find more information about these events at our website, westparkfoundation.ca. And of course, for those here in the room, please stay. We have some cookies, Canadian-made cookies, in Toronto, in the city of Toronto. And as well, we are offering tours after the little social time that we spend. And Ashley and Martha, so Martha in the back, Ashley, would be very pleased to share with you this state-of-the-art building that is helping people get their lives back. So thank you.